Well, my friends, today is a very, very special day because we have now, my right side, one of the most respected researchers and scientists in a very breaking through field of medicine. Cholesterol, metabolism, omega-3, inflammation, short-chain fatty acids, and very important topics. We're having today a brief conversation with our great professor, Michel de Lorgeril, one of the most important scientists in this modern world. Professor, be more than welcome to Brazil. It's a great honor having you here, and I hope and I'm sure your contribution tomorrow in your lecture will exchange ideas and minds in order to improve the quality of life. Be more than welcome.
Thank you very much for your invitation.
And let's begin with a very, very interesting topic. We, as physicians, as well as medical practitioners, healthcare professionals, have been told during the most part of our lives that we have to be very careful about this strange and dangerous molecule named cholesterol. Double check your cholesterol. Don't allow your cholesterol increase because this is a monster that will kill you more quickly than you can imagine. Professor, my first and good question, is cholesterol that bad guy, or there is something different we have to understand before you criticize and blame cholesterol as one of the most important enemies in the history of humanity? Do you agree with these ideas?
Definitely, cholesterol is innocent. Moreover, I think that cholesterol is very good for your health. But there are so many wrong ideas about cholesterol. And the first wrong idea is that cholesterol is a lipid. Cholesterol is not a lipid. Cholesterol is a sterol. Cholesterol is a sterol. And when you fight fat in your diet or fat in your blood, in fact, you don't fight cholesterol. This is the first major idea. And then when you look at the anatomy of the injury in your arteries, in fact, what we call plaque, atherosclerotic plaque, made with cholesterol or with fat. The atherosclerotic plaque are benign tumor. If you analyze the composition of the plaques, they are like uterus fibroma. You know?
Yeah.
This is benign tumor and nothing to see with fat. This is curious, you know.
Very curious.
Two things so wrong. Cholesterol is not a lipid, and the atherosclerotic plaque are not made with fat and cholesterol.
Well, very good beginning. But let's move forward. Considering that for some unknown reason, from your point of your life, many people get your cholesterol levels increasing and increasing and increasing, that come to a point every day lower, surprisingly. I belong to a generation in medicine that you only prescribed drugs to lower cholesterol. One, if the total cholesterol was over 280, plus a very clear reason to consider this patient having a risk higher than the overall population. Nowadays, we can see year after year and after year, our traditional medical societies publishing guidelines decreasing, scarily decreasing the levels. Brazilian, for instance, Brazilian Society of Cardiology considers unacceptable to let one person have cholesterol, total cholesterol over 190. No matter if you have or no risk factors, that's for the fact your lab test is over 190, you have to get a medication to decrease this. What do you think about these ideas?
Oh, it is a caricature of medicine. You know, there is a formula among the conventional doctors, especially conventional cardiologists, is that the lower the better. And certain cardiologists claim that the best cholesterol level is in the blood. You know, this is a caricature. But in fact, we don't have any strong scientific data to claim that there is a good level of cholesterol or a bad level of cholesterol. And it needs graphic epidemiology to explain that. But just one wrong idea again. The idea is that there is a good cholesterol and a bad cholesterol. This is completely stupid. You know, this is good for Walt Disney story because cholesterol is a molecule. How can you say that there is a bad cholesterol and a good cholesterol? They don't say there is a good glucose and a bad glucose. This is just stupid. Okay. But you know, now we have very good studies, clinical trials, testing new molecules that are able to decrease the bad cholesterol by 40%, for instance, and that the same molecules can increase the good cholesterol, the HDL cholesterol, by more than 100%. And finally, after at least 4 clinical trials testing this kind of drugs, there were no effect at all on the clinical endpoints. No difference between placebo and these new molecules in terms of acute myocardial infarction, stroke, or cardiac death. You know, this is so impressive demonstration that the idea of good and bad cholesterol is
Completely wrong.
as you say.
Yes. And one very worrying thing is we can see the number, the amount of people using lowering cholesterol drugs is increasing and increasing and increasing. Not happens on the other side. What's the point of view here? The more people you find in taking these medications, the more people you decrease in your quality of life and health, and not change the total number of people that get infarction or heart disease or brain disease. Or what's going on with medicine? Where's the point we have to shift this paradigm?
There is a lot of confusion about that, because in the same time as we prescribe statins, for instance, in the European population, in the same time we fight against tobacco smoking. And we have seen the incidence of acute myocardial infarction decreasing in the same time. Less smokers and statins in the population, more statin in the population. And of course, smoking is not innocent. It is a very dangerous lifestyle parameter. But today, it is very difficult to make the difference between the effect of smoking and statin prescription in epidemiology. We need clinical trials with randomization and statins against placebo, and the number of smokers are the same in the two groups. When we do this kind of clinical trials, we don't see any positive effect of statins. But for the media, for the academic people, for the industrials, for the health authorities, it is very difficult to accept that. But today, I think that today we have a lot of data to stop this kind of bad medicine.
Yeah. And one very important topics will show you is that one of the most important results of your wonderful job is, it seems that having high levels of cholesterol during the aging process, it seems not a bad idea, is it? What's the main point here? High levels of cholesterol during the aging process is a big problem, or maybe a good solution?
No, it is just a physiological process. Yeah. Let's take a very simple example. The women at the time of menopause, the sexual gland stop to produce sexual hormones, estrogen and progesterone. Okay, and of course their organ need these hormones, but they cannot produce these hormones. And the message coming from all of organs to the brain is, we need hormones, but are done from cholesterol. In the ovaries or in the testes, we make sexual hormone from cholesterol. It is a substrate from which we do the sexual hormone. Of course, if you send the message to the brain, we need hormones, the brain will say to the liver, send cholesterol to the glands so that they can make the hormones, but they cannot. And of course, you have an increase of cholesterol level in your blood, from the liver to the blood and then to the glands. But the glands cannot make sexual hormones. But now, if you give sexual hormone to the women at the time of menopause, you can see that cholesterol is decreasing. Estrogen and progesterone increasing.
Down-regulating.
Okay, and you know, the process of cholesterol increase at the time of when aging or at the time of menopause, this abrupt phenomenon in women. It is more progressive in men, but it is just a physiological process. This is normal. Don't perturb the physiological process. And if you give hormones to the women at the time of menopause, you see that the cholesterol is decreasing, but the risk of heart disease is increasing. Fantastic demonstration that cholesterol is innocent.
Wonderful. So, tomorrow we have a great opportunity to learn a lot from this giant of medicine, and final considerations in another very exciting area of his research, that are polyunsaturated omega-3 fatty acids and the importance for health. Can you resume these concepts for our physicians over there?
Well, I would just say one thing. What is important is not to supplement the people with omega-3. What is important is to identify the people with deficiency or insufficiency in omega-3, both marine omega-3 and plant omega-3. This is a point. Don't supplement the people if they don't need, but identify the people who need to correct their deficiency or their insufficiency in omega-3.
Usually you apply that AA-APA ratio to identify the deficiency, the relationship between arachidonic acid and eicosapentaenoic acid? Or
it is another issue. First, to see what is absolute EPA, DHA, and alpha-linolenic acids. It is the most important one in the blood and in the diet. Very important to verify in the diet, not only in the blood.
very nice.
And then there is another question.
Another issue.
It is a ratio omega-6, omega-3, but it is another issue.
Perfect. So, very, very glad to having you here. We are open-minded and arms and red carpet for you tomorrow, and a great honor. And I hope we enjoy you stay in Brazil, and so we can all learn a lot from you. Professor, thank you very, very much.
Thank you very
being
much for
here.
your invitation.